As men age, their bodies begin to speak in quieter, subtler ways. What once felt strong, steady, and simple now shifts slowly, sometimes uncomfortably. And yet, so many men carry these changes in silence. This video is for every man over 50 who has ever wondered, is this normal? It's for the husbands, fathers, grandfathers, and brothers who want to understand their bodies better, not out of fear, but out of respect. Because there is nothing shameful about change. And there is nothing weak about seeking help. In fact, paying attention to your private health is one of the most courageous and loving things you can do for yourself, for your partner, and for the years ahead. Number 1, understanding what changes and why. By the time a man turns 50, several natural shifts begin to occur in the body. Testosterone levels start to decline. Blood flow slows. Muscle mass reduces. Prostate gland begins to enlarge in many men. Erections may become less frequent, less firm. Urinary habits change. These aren't signs of failure. They're signs of aging, and aging, when embraced wisely, can be lived with dignity. The problem is, many men don't know what's normal and what's not. So they ignore symptoms that need attention, or they panic over changes that are harmless. Number 2, erectile changes. What's normal, what's not. One of the most common changes men notice after 50 is in their sexual function. Erections may take longer to achieve. They may not be as firm as before. You may notice less interest in sex or less energy during sex. This is very common. It's not a reflection of your masculinity or worth. However, there are times when changes may signal an underlying health issue. Signs to watch: difficulty maintaining an erection consistently. Erections that are painful. A complete loss of sexual interest over time. Erections occurring less frequently, even with stimulation. Nocturnal nighttime erections stop altogether. These could be signs of low testosterone, called low T. Diabetes. Cardiovascular issues. Nerve damage. Psychological stress or depression. If you notice ongoing changes, don't guess, talk to a doctor. A simple blood test or physical exam can rule out serious problems. I'll continue building the rest of the narration in this style: informative, calming, respectful, covering topics like urinary health, prostate awareness, testicular changes, penile vein visibility and vascular health, mental and emotional health impacts, when and how to seek medical care, prevention and lifestyle improvements. Number 3, urinary health, listening to the flow. As men grow older, changes in urination are common but not always normal. You might notice a slower or weaker stream. Waking up at night to urinate more than once. Difficulty starting the flow. A feeling of incomplete emptying. A sudden urge to go, even when the bladder isn't full. These symptoms are often caused by benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate gland. It's very common after age 50 and often manageable. But when left untreated, BPH can lead to bladder infections, kidney problems, incontinence. When to see a doctor: if you need to urinate more than 8 times a day. If you see blood in your urine. If there's pain or burning during urination. If you feel pressure or pain in the lower abdomen or back. There's no need to live in discomfort. Many treatments exist, from lifestyle changes to medication and, in some cases, minor procedures. The key is to seek help early. Number 4, prostate health, protecting the silent organ. The prostate is about the size of a walnut and sits just below the bladder. It plays a role in producing semen, but its location means it can greatly affect urination as it grows. What every man over 50 should know: the risk of prostate cancer increases with age. It is one of the most common cancers in men but often very slow growing. Early stages rarely show symptoms. That's why screening matters. The PSA test, prostate-specific antigen, is a simple blood test. While not perfect, it can catch early signs before symptoms appear. Talk to your doctor about when to start screening, typically between ages 50 to 55, or earlier if family history exists. What your PSA levels mean over time. Any unusual sensations, such as pressure or pain in the pelvic region. Remember, early detection saves lives. Number 5, testicular awareness, gentle monitoring. While testicular cancer is rare in older men, it's still wise to be familiar with your body. Performing a gentle self-exam once a month in the shower can help you notice lumps or swelling, a change in size or shape, a dull ache in the groin or scrotum. Most changes are harmless, but it's better to catch something early. Even more common after 50 are conditions like hydrocele fluid buildup, varicocele enlarged veins, epididymitis inflammation due to infection. Any persistent swelling, pain, or heaviness in the testicles should be evaluated by a doctor. Number 6, visible veins and vascular changes. As men age, veins may become more visible on the penis. This is usually due to thinning skin, reduced subcutaneous fat, more pronounced blood vessels with age. Most of the time, this is entirely normal and not a cause for concern. However, see a doctor if veins become suddenly enlarged or painful. There's any bruising or hard lumps. You experience aching, swelling, or changes in color. These could be signs of vascular issues, varicose veins, or rare blood clots. Again, awareness, not fear, is the goal. Number 7, hormonal changes, understanding low testosterone. Low T. Testosterone is the hormone most responsible for a man's energy, muscle strength, mood, and sexual drive. After 50, it naturally begins to decline, often slowly, but noticeably. Signs of low T include constant fatigue, low libido, erectile difficulties, depression or irritability, decreased muscle mass, increased belly fat, difficulty concentrating. Not every man with these symptoms has low testosterone, but if several of these persist, it's wise to get a blood test. Treatment options include lifestyle changes, diet, sleep, exercise. Testosterone replacement therapy (TRT) only under medical supervision. Supplements with caution and medical approval. Important: never self-medicate or buy hormone products online. Misuse can cause serious health issues, including heart problems and infertility. Number 8, mental and emotional health, the silent struggle. Men over 50 face a unique emotional shift. Retirement, health changes, family transitions, or feelings of lost purpose can quietly affect the mind. But instead of speaking out, many men withdraw. They stay silent, believing they must appear strong, unshaken, unaffected. But real strength lies in acknowledging those feelings, not hiding them. Watch for signs like prolonged sadness, loss of interest in life, social withdrawal, irritability, trouble sleeping, thoughts of worthlessness or guilt. Depression in older men is often overlooked even by themselves. But help is available, and healing is possible. Talk to someone, a doctor, therapist, or even a trusted friend. You don't have to go through it alone. Number 9, the role of diet, exercise, and rest. The body over 50 needs a different kind of fuel and attention. Eat well, focus on heart-healthy foods, lean proteins, good fats, and lots of vegetables. Reduce sugar and salt. Move daily, even walking for 20 minutes a day improves circulation, libido, and mental clarity. Sleep deeply, aim for 7 to 8 hours. Good sleep helps hormone balance and cellular repair. Limit alcohol and tobacco, these impact vascular and sexual health directly. Hydrate, dehydration can quietly cause fatigue, headaches, and even erectile issues. Good health isn't about perfection, it's about consistency. Number 10, when to see a doctor and what to ask. Many men hesitate to see a doctor about intimate issues. But you'd be surprised how many others ask the same questions. You are not alone, and you are not weak for wanting clarity. See a doctor if you notice new or persistent changes in urination or sexual function, testicular lumps or discomfort, changes in energy, mood, or concentration, pain or discomfort in the lower abdomen or pelvic area, visible or painful vein changes, signs of depression or chronic stress. Ask about PSA screening for prostate health, testosterone levels, vascular and cardiovascular health, mental health support options, diet and lifestyle guidance. Number 11, sexual connection beyond performance. At 50 and beyond, intimacy begins to shift not just physically, but emotionally. Many men feel pressure to perform, to stay the way they were at 30. But the truth is, connection after 50 isn't just about performance, it's about presence. You may find, touch means more than speed. Eye contact becomes deeper than words. Emotional safety leads to physical openness. Yes, changes in erections, stamina, or desire are real. But relationships can grow more intimate, soulful, and rich in these years if both partners learn, adapt, and communicate with compassion. Talk with your partner openly. You are not less of a man, you are simply entering a new, more conscious phase of love. Number 12, stress, blood pressure, and the silent impact on men's health. Men often carry stress in silence through work, finances, family responsibility, and unspoken fears. But stress is not invisible to your body. It quietly raises blood pressure. It tightens vessels and weakens the heart. It affects sleep, hormones, and sexual health. Chronic stress is linked to erectile dysfunction, weight gain, high blood pressure, fatigue and mental fog, heart disease. What can help? Gentle breathing exercises, even 5 minutes a day. Meditation or prayer. Walking in nature. Talking to someone you trust. Taking breaks from constant responsibility. Self-care is not selfish. It's strength. Especially for men who've spent their lives caring for others. Number 13, bowel and digestive health. What to watch. After 50, digestion can slow. The gut may react differently to food, stress, or inactivity. Watch for unexplained weight loss, blood in stool, ongoing constipation or diarrhea, new food intolerances, bloating or pain that persists. These may be signs of polyps or early colorectal issues. Digestive inflammation, diet-related imbalances. Colon cancer screenings, usually starting at age 50, are crucial and often life-saving. The test might feel uncomfortable to think about, but it's quick, and it could add years to your life. Don't let discomfort cost you your health. Number 14, skin, bones, and muscle changes. As testosterone drops and metabolism slows, your body's structure changes, Skin may become thinner or drier. Bones may weaken, especially if vitamin D and calcium are low. Muscle mass may decline, leading to slower movement and fatigue. But you can slow this process: eat calcium-rich foods and take vitamin D. Do light resistance exercises, bands, light weights, walking. Stay active daily. Avoid smoking, and limit alcohol. Remember, aging well doesn't mean preventing change, it means responding to it wisely. Number 15, a gentle ending: listen, learn, and live fully. Let S end with truth, not fear. Growing older isn't a curse. It's a calling. A calling to listen more closely to your body. To honor your health instead of pushing past pain. To embrace your changing self, instead of hiding from him. You are not just a man aging. You are a man deepening, expanding, awakening. Take care of your body, not out of fear, but out of respect. Ask questions. Get answers. Be brave enough to speak up. Because someone loves you. And someone needs you healthy, aware, and here. You've come this far. And there's still so much more ahead. Number 16, the importance of regular checkups: prevention over reaction. After 50, you can't rely on how you feel alone to determine how healthy you are. Many serious health conditions like high blood pressure, diabetes, and prostate issues develop quietly, without early symptoms. That's why you need an annual physical exam, blood pressure monitoring, blood sugar tests, prostate health screening (PSA), colonoscopy every 10 years or as advised. These are not just appointments. They're opportunities. To catch what you can't see. To stop what you can't feel yet. Going to the doctor doesn't mean something is wrong, it means you care enough to make sure everything's right. Number 17, dental and oral health: not just about teeth. Oral health is often ignored in private health discussions, but it matters more than you think. After 50, you may notice dry mouth, gum sensitivity, loose teeth, mouth sores that heal slowly, receding gums or bad breath. These issues can signal gum disease linked to heart problems, early signs of diabetes, infections that can spread to the bloodstream. A dental checkup every 6 months isn't just about teeth. It's about whole body health. Your smile is a sign of vitality. Keep it strong. Number 18, hearing and vision: the subtle decline. You may not notice it right away, but after 50, you may need people to repeat things. TV volume gets louder. Night driving becomes harder. Small text gets harder to read. Hearing and vision loss happen gradually, and they deeply affect confidence, safety, and mental well-being. Untreated hearing loss is linked to cognitive decline and even depression. Don't wait until it's unbearable. A simple exam, glasses, or hearing aids can bring back clarity, peace, and social connection. Aging doesn't mean fading. It means adapting. Number 19, sexual health in a committed relationship: communication is everything. Many men feel shame or frustration around changing sexual performance. But in reality, relationships after 50 thrive not through performance but honesty. If things are changing, talk to your partner gently. Share how you feel emotionally, not just physically. Ask how they're experiencing the changes. Explore intimacy beyond sex, like touch, laughter, presence. Sexual connection evolves. It can become deeper, more emotional, and more intentional with age. A loving partner doesn't need perfection. They need presence, trust, and effort. Number 20, the final message: you still matter. Let us close this journey with truth and tenderness. You are not invisible. You are not broken. You are not too late. You are a man of experience, of strength refined by time, of wisdom born from struggle. Your health, especially your private health, deserves respect. Not shame. Not silence. Not avoidance. Get the checkup. Ask the questions. Make the changes. Speak with honesty. Because this world still needs your story. Your children still need your example. And you still have many years left to live boldly, love deeply, and walk proudly in the man you've become. Your health is your power. And it's never too late to take it back. Thanks for watching. Don't forget to subscribe for more timeless wisdom. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Reading your comments give us great motivation and encouragement. If you enjoy this video and found it helpful, please like, subscribe and share. Thank you for spending these moments with us. Stay strong, stay wise.